Welcome to In Alignment, Life, Leadership, and Dentistry. I'm Dr. Sara Mahmood, dentist, aligner educator, speaker, and mom of three, navigating the wild ride of clinical practice and family life. This podcast is your go-to space for all things clear aligners with real talk on dentistry, leadership, and the juggling act we call life. Whether you're looking to level up your aligner skills, build more confidence in your workflow, or just feel a little more seen in this season, you're in the right place. Let's get in alignment and grow together. Okay, let's talk about something that comes up constantly, which is a clear aligner consultation, workflow, all of that. How do we do it? It doesn't need to be complicated, and it definitely doesn't need to be a long visit, but they do need to be intentional and structured because when they are, you'll see a huge boost in efficiency and case acceptance. There are two main ways we approach consultations in my offices. One is hygiene-driven, meaning it happens during a routine cleaning appointment. And the other is a dedicated aligner consult, which is a completely separate visit designed to dive deeper into a treatment plan. Each has a purpose, each works, but the key is that in both cases, you have to use the scanner and simulator. You've probably heard me say this before, but seeing is believing. Patients need to visualize what's possible. So let's break it down. The hygiene-driven consult is my absolute favorite. It happens right in the hygiene chair. The patient's already there, they're already in a dental mindset, and most importantly, they already trust the hygienist. These consults are short, like 5 to 10 minutes max. And the goal is not to treatment plan. It's usually to plant the seed, to screen, to educate, and to say something like, hey, I noticed this crowding is making it harder for you to keep certain areas clean. This could obviously increase your risk of cavities or gum issues. So let's talk about how aligners can improve that. That's it. What makes this flow even better is that the scan is already done and the simulator is loaded. That way, if the patient is interested, the doctor can walk in, see the visuals, and guide the next steps without skipping a beat. Now, if the patient wants more info or isn't quite ready to say yes, that's when we book the dedicated consult. These are about 30 to 45 minutes and go way deeper. We get a full picture of their goals. We gather all the records. Hopefully, you're getting the scan first so that you have that to base off the conversation, but any additional records that need to be taken can be taken. And we have that full financial conversation as well. These can be done virtually. So if you have their scan, you can overlay your virtual conversation with their scan and have the conversation that way. You just want to try to be sure about using a HIPAA compliant portal. Now, what's really important is that if someone is coming in for a scheduled aligner consult or doing a virtual consult, your financials better be ready to go. That includes insurance verification, payment options, and any tiered pricing structure you use. In my practice, we offer both a comprehensive and express package, and we make sure the patient understands both. Also, when you explain treatment, use real words. Don't say things like attachments, say tiny tooth color buttons. Don't say IPR, say smoothing between the teeth to create space. It does make a difference. And one last thing, never make the mistake of waiting until a patient says yes before collecting records. If they're doing this consult in office and they're in their room considering treatment, get what you need right then. Otherwise, you risk delays or losing the case altogether. In my practice, we keep records for up to 6 weeks, and that gives the patients time to think over it without needing another appointment. But after that, things can shift and we'll likely need to rescan. So if you're trying to grow your aligner program, this is one of the best places to start. Nail your consult flow, make it repeatable, make it easy for your team to execute, and most importantly, make it easy for your patients to say yes, because that's where the magic happens.